Good morning, friends. This is Laura with Potpourri of Life. I hope that you're having a great day. Today I've decided that today was the great day or good day to start sharing a little bit about my Lyme disease journey. Now, I was diagnosed with chronic persistent Lyme, and that was back in 2014. And this was after years of testing and so forth, and the tests all came back telling me, you're normal, there's nothing wrong with you. Until I went to one of my doctors who was treating me for something totally different, and I was talking to him about my overall feeling, because at this point I just gave up. And he asked me some questions. I said, it's really not worth complaining about, because everybody tells me I'm fine, I'm normal, everything is okay. And so as he goes, well, I want to hear your list of symptoms. And so I started telling him. And at that time, the worst of my symptoms were, one of the key things that I recall was, I told him, I said, I feel like I'm being eaten alive from inside out. And he looked at me, he goes, really? That was his response to a lot of my symptoms. Because the more I shared with him, the more he started looking at all the tests I've done. I have done cardiac tests, I've done lung tests, I have done fibromyalgia tests. I have been tested beyond measure. And that was before 2014. And when I went to see him for something else, he was starting to listen a little bit more intently and realize there's more to her situation. And we discovered that one of my procedures may have caused everything to just kind of explode. And sometimes that can happen with Lyme disease, because the spirochete, the bacterium that gets into your body, it rests. It kind of digs its way in. I believe it's only about 25%. Let me see my notes here. I believe it's just 25% of patients remember a tick bite. That's all. I believe I read that only 9% get that rash. So two things were against me. I don't recall the bite. I don't recall the rash because I didn't have them. One of the symptoms is severe flu-like symptoms with no explanation, dizziness and all that. And when I was seeing him, the last time I remembered was a couple years earlier or something. Then as I was talking to him, as I progressed, I said, the worst that I ever felt was when I was about 14 years old. And so I explained to him what it was is I was just feeling really, really tired. I couldn't focus. I felt like I was walking in a haze, in a daze, where it's like I was just moving about. And those of you who know, I did grow up in a dysfunctional family, so you didn't complain about anything. You just carried on. And so I had this going on. It was like, it was better to be at school than to be at home. And I just kept going. And my brothers noticed. They said something to my mother, why is she so quiet? Because my brothers were really good at irritating me. Being the only girl at that time, they were horrible to me. I love them, but they were horrible to me. And I just went up to my room, because I was tired. I just said, Mom, I'm really tired. I have to go to bed. To her, it probably meant nothing, because that was about the age when the girls change, their cycles come on and all that. So, she probably just thought it was something like that. But we didn't know about Lyme disease back then either. So I thought about it, and it's like, I went to school, I was in a haze. I went from one class to another. I didn't raise my hand, and I was one that was very inquisitive, always asking questions, and I would just, I was a very studious person, but I enjoyed being active too. But during this time, it was a good couple of weeks, and it might have lasted about a month. I just kept going. I wasn't sick with colds, flus, or anything like that, but that flu-like exhaustion and not feeling 100% was there. So that's kind of where I believe it started, and in talking with my physician, he thinks that it may have been. And one of my procedures may have taken a lot of things out. Now today is not going to be long. I'm not going to tell you my whole Lyme story. I'm going to this is the introduction to a Lyme series of my story. And I will tell you, when I finally shared it to people, once my doctor diagnosed this, and this is why I have hesitated sharing this on my YouTube channel. There's a lot of people that don't believe in Lyme disease. They think it's curative within just a couple of weeks of antibiotic therapy. Well, for the most part, that's true if they catch it right away. Not 20, 30 years later, not 10, 15 years later, right away. You get on treatment. But you can't ignore that patient because you need to follow up. But even in today's culture, doctors are not following up with patients, and that's kind of sad because they need to, and they won't give referrals out. My grandson got bit, and he got the rash, and I said, you need to get him in there, because I didn't want him to go through what I've been through. So when I was finally diagnosed, I had given up. I thought I was dying. I didn't complain anymore. I just gave up. It's not that my primary care physician at that time didn't care about me. I think she honestly did care. She was a wonderful, compassionate lady. She just couldn't figure out what was wrong. And prior to that, I had another doctor. And there's a lot of symptoms that go along, and I'm going to go over a slew of symptoms. But before I share any of that, we have to also take into account that some diseases overlap, meaning that I may list some symptoms, but that doesn't mean you have Lyme disease. I had to be tested. I did do the regular testing that the hospitals do, which came back negative every single time. That was the other reason I gave up on it. And yet when I finally found this doctor who listened, and like I said, he was a doctor that I had for quite a few years prior to this, maybe 8, 10 years or something. Man, I've been with him a long time. When he started listening, he realized it was more than a hormone imbalance. It was something bigger, something more than what we were doing. So one of the things that I was tested for was fibromyalgia. I cannot tell you how many times I have been sent to a pain specialist, and then they start poking you and they press hard, or maybe I'm just sensitive, and they would get 8 out of it. I forgot how many. I think there's 18 points or something. Be close to getting all of them. The last time I went to a pain specialist, which one of my care providers recommended that I go, and I went there, and at that time I was seeing a chiropractor who was in the same hospital group and everything else, and he saw my notes later, and he goes, Laura, I saw how he treated you. I said, it was awful. He would not listen. This pain specialist would not take the time to listen, nor did he read my chart before he saw me. But one of the things that he did, he started doing the poking. Now, I've had this test done multiple times, and I'm like, I said, if you're checking for fibromyalgia, I don't have that. He goes, well, how do you know? Okay, folks, there comes a time when most of us know our body. Maybe not. I've been told that I am a patient who knows my body really well. But after you've been tested multiple times, you kind of know what's right and what's wrong. I'll wait for that to go by. I'm outside today. There's not many days to be outside left in the season as the summer comes to an end and school starts. So I knew what he was doing, and he kind of just ignored me. And I left very upset. It took him a week to finally get his notes onto my chart, which typically it should be on there soon after you've left. Or if not that, because they have to review everything, at least within a few days. Nope, didn't happen. Now, I have a few doctors who do understand Lyme disease, okay? They don't, let me take that back. They understand that Lyme disease is real. They don't specialize in it, so they don't necessarily understand it completely. Some of them know that it can destroy a person's life in the sense that it messes up your system. It messes up a lot of things about you. And, this is another thing. If you've been watching me, sometimes I kind of do that, I'm focused and then I kind of go off to another one. That's part of Lyme disease. I don't mean to. I've been really trying to be very focused. But sometimes even with notes, I kind of like, oh, squirrel. That's what we call it here. And my husband will point it out. I'll be talking, all of a sudden I'll think of something else. And he goes, oh, squirrel. Because you know how squirrels can distract you? Things like that can distract us. Okay, now saying that, there are some people without Lyme disease that this can happen to. That's why I want you to be very careful before you take what I share with you and say, that's what I have. I'm going to go tell my doctor what I have. Why I'm sharing is so that this can be hopefully educational to those of you who do suffer from Lyme, or from some of you who don't suffer from it but know somebody who does, so that you can better understand them. It's going to be hard. Lyme disease is so difficult, it's horrible. Now, why do I bring it up? Because I'm dealing with Lyme symptoms again. And it's breaking my heart because I see the symptoms coming in again. And I don't know how to stop them. And some of them have been ongoing. And I've been kind of like ignoring it. And then my husband was massaging some pain out, and he goes, Laura, you got the Lyme scratches back. I said, because I can't see my back. And there's some other areas where he can see and I can't. And I'm like, yeah, I kind of thought it was coming back. Typically in the summer I do well. But for some reason this summer I'm having a hard time in the sunshine. Now this past spring I was able to get out and get plenty of sunshine, and I was doing great. Other than some other health issues that, I'm kind of hoping will go away someday. And the hard part about this all coming to fruition right now is that, as I've shared in prior videos, the healthcare system has changed so much. I cannot be authentic. When I went in, I shared in one of my last videos, I think it was my Sunday reflection one, because when I went into the health facility and the person slapped my hand and she says, oh, you can't do that. That Lyme response of not wanting, a reaction of wanting to hit her. Now, I'm not one to hit people. I wanted to hit her. I had to step back and take control of whatever was going on inside. I'm like, first of all, I didn't understand why she did that. I spoke up to her, very professional. I said, don't do that to me. And I'm very firm. If I don't like something, I am going to make sure you know that did not make me happy. But for the most part, I am a very kind, generous person. Yet when somebody is talking down to me, when I consider all of us equals. I don't care if you're a lawyer. I don't care if you're a physician. I don't care if you are the rug sweeper or the trash collector. We were all equal individuals that deserve respect and kindness. And when you're going into a health facility, how about a little bit of compassion? So I did. I stepped back and I said, as I left the situation, I kind of like, whoa, that was close. And so now I'm kind of afraid to go back to that facility because I don't want my Lyme symptoms to be revealed and received in the wrong way. I don't know if that makes any sense to you, but I hope that it does. You know, if you understand, make a comment so I can see that I'm getting this across. I don't have a lot of followers yet, but hopefully those who have Lyme will start to kind of like interact and share. Another thing I mentioned, that fibro is, you're sometimes misdiagnosed with fibromyalgia. You're also sometimes misdiagnosed with multiple sclerosis. I was tested multiple times with this. Now, the last neurologist that I saw, he was kind of like not sure. He knows about Lyme disease, but because he's a specialist in multiple sclerosis, we can't deter from that. The way the medical system works, no, we focus on this. And I said, because he told me, he goes, you don't have full-fledged MS. I said, I didn't think so, but I'm here because my new doctor recommended that I come here. I said, this is what I have and this is what's happening. He goes, well, these symptoms here are part of MS. I said, can you prove to me that I have MS? He goes, well, there's no real test except for symptoms. And he says, and when you come in, you're not showing those symptoms. I said, no. I said, because I can't always show those symptoms. You know, if even some of the ones that I was showing, they weren't big enough for him to worry about. He goes, and this was, let's see, okay, this was about 3-4 years ago. He told me, you have primary progressive MS. I said, what's that? He goes, it's basically, there's nothing we can do for you. I said, so why am I here? He goes, you have some symptoms that don't show consistently. So we can't give you, there's no drugs to help you. I said, well, that's good. I really don't want to be on Big Pharma's roll call. He says, there's not much we can do for you. But he says, we need to keep an eye on you. We need to see you every 6 months, I think is what it was. I said, okie dokie. And then we did, I did a spinal thing. And the hospital ones do not test completely for the Lyme spear sheets. So I knew that this might come back negative. So what I did was I went off all my herbs. And because when you're when you have a needle going into your back or you're having surgery, you don't want to take a chance even with herbs that you could bleed. I wanted to get in, get out. Now some of the people that were working there knew about Lyme disease. And they knew that most of my treatment was massive amounts of antibiotics. And they said, that's horrible for your body. I said, I know, but I want to be better. So the test came back, and I'm not sure, did it come back negative because they're not testing for the right spear sheets? And it was interesting because my Lyme doctor asked them to test for something. They refused. And this is a problem with our healthcare system because this hospital will not work with this hospital. They won't work together. And here they have a patient that is using both who wants to be well, and they won't work together. That's a crime. That's a real crime. And there's nothing I can do. So I do the best I can. So I told him, I said, this is my neurologist. I said, I went off it. And I said, and these are all the symptoms I had. And so he goes, why did you go off it? And I told him, he goes, don't ever go off those herbs. I said, why? He says, because they're making a difference for you. And you know what that told me? Because I told him, I said, then you're agreeing to Lyme disease. He goes, no, I can't say that. He says, but if they're helping you, you need to stay on them. Well, as a patient, as somebody who has dealt with people denying what I have, I know what he was saying. And he can't legally say that, and it can't be on my chart. So I asked him, I said, are you going to put primary progressive MS on my chart? He goes, yeah, I'll put it in my notes, but it's not in there. It might be in his personal notes, but it's not on the list of stuff. My chronic fatigue is there. My Lyme disease is there because that was brought over from before I started going to the hospital there. And they've added different things that don't make sense to me. It's like, that doesn't even make sense. That's not even me. But you know what? To get that stuff off your chart, it's insane. So, that being said, I want to go over some things because I want people with Lyme disease to find joy. And first of all, you're going to have moments of tears. You're going to have moments of disbelief in how you've been treated, not just by the medical community, but also by people who don't know you, who do know you, and will tell you Lyme disease is a made-up disease. Well, they say that about fibromyalgia, but now that's okay. That's now being covered by insurance. Lyme disease, it's hard to get a specialist within a medical community, a medical establishment. It's really hard to get specialized treatment that's covered by your insurance. And the worst part about it, which I find awful, the price to see these specialists is bankrupting people. They get diagnosed and they call them back in, and it's horrible. Now, if I didn't have insurance, my insurance was paying for all that treatment that I went through. If I didn't have insurance, I wouldn't have done it because I'd have no money, and I'm not going to put that kind of stuff on a credit card. Won't. But I did do the one test that he asked me, and it was expensive, and it has become even more expensive. It's unattainable for those of us who are on modest incomes. So I do have an appointment with him, and I know that I need to do that test. But a lot of Lyme disease is clinically diagnosed because there's no real good blood work that is covered by insurance. He has the history. My cultures came back that it was CDC Lyme disease with everything, those things that were checked off. There was quite a bit there. So I was grateful for that because now he could treat me without a problem. And I was able to get treatment. And I stayed on it for 4 years. And not everybody gets better with ongoing care in terms of antibiotic. He was trying. He goes, Laura, we have to go at this strong. You need to do this. It was making me feel worse. It was making me feel awful. So I will share more of that journey part as I go on, but I want to share some things with you. Oh, and another thing. I was telling my husband today, before I came out here, I said, you know what another symptom is? And I said, I now understand it. Overcompulsive disorder. I just recently read that. That's me to a T. I am reading all the time. I'm always trying to understand. And no, I'm not just going to Google. I mean, I might go there to start, and then I read further, and I will read books, and so I am a little compulsive in that area. I am that way with my herbs. So when I share about my herb learning, that's why. And I have been studying herbs for a long time. So I'm compulsive. But the other thing is, I know my body well enough to be able to say, this, and this is happening. And sometimes, like my other specialist, I'll tell him this is happening, and he goes, I don't know why. And going over my list again that I have to fill out for my Lyme specialist, this is why. Because I was on 4 years of strong antibiotic therapy, it doesn't mean it will get rid of Lyme disease. Now, if you're treated right away and you're followed up within the next 3 to 6 months, and they can tell that, okay, you're all set. But if you've had it for a long time and they try this, there's nothing they can do. The same with herbs and stuff. I can get it to go away and be okay. But now I'm dealing with the brain fog again. I'm dealing with tremors. I'm dealing with more bladder issues. I'm dealing with more brain fog. There's sensitivities. Pain is coming back. And so all I do right now is one specialist works in one area, but some of the symptoms I've been telling them, they're having a hard time connecting the dots, and they're not saying it, but I can tell. And I've given up. I've given up on anybody being able to help me, and partly because I know my Lyme specialist is getting close to retirement, and I think he's retiring really soon. And that makes me sad, because I don't know where to go, and the people that I know about, they're expensive. And that's hard for me to accept. And because they won't take insurance. So you're kind of stuck. What do I do? And that's why people are going bankrupt who have Lyme disease or even any other disease that is not the norm or fits in with other specialists who share this stuff. So I am going to share some things, because generally the early signs of Lyme disease, if you get it, is your rash. And like I said, only about 9% get a rash. 25% remember having neurological symptoms. Let's see, there's fever and flu-like symptoms, illness, muscle aches and pains, joint pain or swelling, fatigue, malaise, and headaches. You could have chest pains, you could have sore ribs, you could have shortness of breath, you can have heart palpitations, you can have your pulse skips, heart block, valve prolapse, heart murmur. And some of these things that are coming back are the shortness of breath and heart palpitations. Those are coming back. I've had heart tests done before. There's nothing wrong. I am in perfect health. Gastrointestinal, nausea and vomiting, GERD, change in bowel function, gastritis, abdominal cramping, irritable bladder or bladder dysfunction, cystitis, and other IBS situations. Joint and muscle pain, feet, ankle pain, shin splints, joint pain, neurological, muscle twitching, headache, tingling, numbness, burning or stabbing sensations, facial paralysis, those with Bell's palsy, dizziness, poor balance, increased motor sickness, motion sickness, wooziness, lightheadedness, difficulty walking, tremor. Should I continue on? This list goes down a huge list. So there's a bird over here. There's a blue jay taking a bath in the water, in the bird bath. So I'm going to go over this list slowly, okay? And I'm not going to go over the rash, because not everybody experiences that, okay? Fever and flu-like illness. I don't have those symptoms right now. Muscle aches and pain, that's back. Joint pain and or swelling, that's back. Fatigue, that's back. Malaise and headaches. So far I'm doing okay though in those two areas. I'm doing all right. I mean, sometimes I don't care, and that's difficult for me to deal with, but it's windy out here. I have to hold my paper. Let's see, chest pain and sore redness. Sometimes I'm getting the chest pain back. When I breathe, I get a catch. Now again, some of these symptoms are not Lyme disease if that's all you have. So you do need to have these other specialty tests to rule those things out. Shortness of breath, I've been getting that back. Heart palpitations, nope. The pulse skipping, I don't have that. Heart block, valve prolapse, heart murmur. I don't have any of that, never have. GI is nausea and vomiting. The only time I get the nausea is when I'm on an antibiotic for an infection. So GERD, never had that, although they like to diagnose me with that. I don't know, I think it's a pretty word for them, I don't know. Change in bowel function, constipation, diarrhea, so that has been fine. I did have it before. Gastritis, abdominal cramping, irritable bladder, and bladder dysfunction. Bladder dysfunction has been ongoing. So, but there are some changes that are happening that it's a different pain that is coming back, and it's knife-like pain, and then you have the other symptoms. So it's very confusing. As it comes back, I realize, oh, this is it. So when you talk to your this is not their norm that they're dealing with. So if I say bladder dysfunction, there's something that doctors can do for you, which is great. You might need to see a urogynecologist because they specialize in that. But if you have Lyme disease, it complicates it for them. Cystitis, you can have, and newly diagnosed irritable bowel syndrome, IBS. Muscular, skeletal, joint and muscle pain. Voila! Pain in your feet. I'm having horrible feet pain. And it goes from my ankle to my foot, and then I have other things in my legs as well. So ankle pain, shin splits, I have that. Joint pain and swelling. I have swelling in one of my feet where the pain is. Joint, neck, or back stiffness. Now that's really hard for the doctors because I have some spinal dysfunction too. But some of these things are just, it's different. And I know the difference between the spinal issues and the Lyme issues. Migrating muscle pain or cramps. Yeah, I can tell you where the pain is and where it's going to and how it's connected. TMJ I don't have. Neck creaks and cracks. Yeah, my husband has to adjust that. Neurological, muscle twitching. I have that. Headaches. Thank you. I am doing okay in the headache area. Tingling. I get some of that. Numbness. Burning or stabbing sensations. Facial paralysis. I've been blessed that I don't have that. Dizziness and poor balance. That's been going on for a couple of months now. I've just been kind of like, Increased motion sickness. There are other things that cause that motion sickness, so I have to be careful. I can't read in a car, and I started to, but I can't. Let's see. Wooziness, lightheadedness. Has nothing to do with alcohol, folks, because I don't drink, and that comes on. Difficulty walking. Tremors. The other day I was in the grocery store with my husband, and my hand started doing this. I said, darn. I said, it's back, David. And once in a while, I don't really care, but it was strong. So, let's see. Confusion. I haven't been confused. I've been pretty alert about stuff. Difficulty thinking and concentrating and reading. That can come in the form of like when I'm talking to you and I kind of like, that's a break in my concentration. And sometimes that's normal for people. Forgetfulness. I don't forget anything at all. More so if you treat me bad. But I also remember the kindness. I remember people who treat me well. And, but I remember things. I am if we have a conversation, I will remember for years. Whereas you might forget that we had that conversation. So I have I don't have that. But there's some poor short-term memory. I'm not dealing with that right now. Disorientation, and what that is, getting lost or going to the wrong places. I was having that before, and only once in the last 2 months did I drive somewhere and I'm like, wait a minute, am I going the right way? Yes, that can happen as we get older, and that can be Alzheimer's and all that, but this isn't Alzheimer's, and you can talk to a doctor and they'll tell you, no, she doesn't have Alzheimer's. But before, I would have a hard time. And I don't know if my brother remembers, but my husband does. One time we were going down to visit my daughter, and I had to stop, go to the bathroom, so we stopped, and I came out and I got into the wrong car. Scared me to death, and the girl that was in the driver's seat scared her too, because I was sitting in the back seat of the car that we came up in. And my brother says, what did you do that for? I used to go to the wrong car. A lot of people with Lyme disease, and it can happen with Alzheimer's too, we go out into the parking lot and we can't find our car. That happened to me when I was at a facility that has a parking garage where it has multiple levels. It took me half an hour to find my car. I was in tears. There was nobody to help me. I knew that it was like, okay, it was on this side. So I had to walk up each floor to find my car. And when I got to the car, I was in tears because I couldn't find my car. Nowadays, I just kind of laugh at things when the symptoms start appearing. But if I have to do that for a half an hour again, I would cry again, because you want to go home after an appointment. And my drive is an hour and 15 minutes. I want to get home. And then at that point, you get kind of scared. Am I going to make it home? So let's talk about, so that's the disorientation. Speech difficulty, that's finding your words. Double or blurry vision. Eye pain. Blindness. And I don't have that. I don't have increased floaters. Increased sensitivity to light and sound. That's been a huge thing for me. It got better, but it's starting to come back. Buzzing or ringing in the ears. I've done really well, and that's back big time. Ear pain. I don't have ear pain. I just have the sound sensitivity and that buzzing. Decreased hearing. I can still hear. Actually, my sound sensitivity is I can hear things that other people can't. And yet, people say I'm so soft-spoken. By the way, I hope that this mic is not being... they say I'm so soft-spoken they can't hear me. And a long time ago, I was talking to one of my doctors, and she said to me, that explains why I can't hear you. I said, what do you mean? Because, like, my neighbor right now, I don't know what's going on with him, but he likes to shoot off fireworks. That sound is painful. You have no idea. It's painful. I don't like going to fireworks because of the pain. And yet, people think nothing of it. And think about the dogs. They have sound sensitivity, and they hide when fireworks are going off. I want to crawl up and hide. Let's see some other things. All right. So some people have decreased hearing. Seizure activity. I haven't had that. White matter lesions on the brain. And they keep seeing stuff on MRIs on me, so it's like, whatever. Low blood pressure. For the most part, mine has been high. I think my last one was pretty good, so I'm kind of like, maybe it's back and I can have low blood pressure. I don't know. Neuropsychiatric. You have mood swings, violent outbursts, irritability, depression, disturbed sleep, too much, too little, early awakening, personality changes, obsessive compulsive disorder. That's what I was telling my husband. I said, look at this. I have to have things a certain way, or I have to research, I have to have an answer, I have to understand. It drives people nuts. Paranoia, panic, anxiety attack, hallucinations. I don't have hallucinations. but I do have anxiety attacks. And when I feel it, I take a deep breath and I kind of relax. Now, the problem with neuropsychological things, people will just tell you, oh, they'll put that in your chart without trying to understand you. And so who wants to go to a doctor when that's all they see? They don't see the whole picture. And the reason of this series on Lyme disease is hopefully people will start waking up. Reproductive. You can have testicular pain or pelvic pain. I get a lot of pelvic pain with it. Menstrual irregularity, milk production. You can have breast pain. You can have sexual dysfunction, loss of libido. I'm doing okay. That's one thing I'm like, okay, I'm doing fine. Others are unexplained fevers, off and on fevers. You might get a fever and you don't even understand why. I haven't had that. Chills, sweats, weight change, whether it's loss of weight or gain of weight. Fatigue, chronic fatigue is horrible, folks. Tiredness, hair loss, swollen glands, sore throat, difficulty swallowing. I have a hard time swallowing, and I make my own herbal supplements. It's getting harder and harder for me to swallow those. And swelling around the eyes. Now, Lyme disease is basically caused by this spiral-shaped bacterium called Borrelia. I don't know if I said that right, but I like the way it sounded. Burgdorferi. I'm going to spell it Borrelia. The other part is Burgdorferi. It's in abbreviations, it's capital B, lower b. So if you see that on your medical chart, it's an abbreviation for that particular bacterium. Now they have another bacterium that they've discovered is part of Lyme disease as well. It's Borrelia, it looks like mayonnaise, mayonnaise. So it's Mayonii. Now they say it's transmitted by the bite of an infected tick. Now there's a variety of ticks out there, so you need to know what kind of tick it is. And I am going to end this really soon, and I'll come back because I'm going to make a series here. These are things that are happening. Now there's a checklist that I have to do before I go see my Lyme doctor, and I'm going to do it. And they do it based on a range, like 0 to 5, it's severe. And so I started working on that. I'm like, oh, I don't want to go back because he's going to want to put me on antibiotics. And I was just on an antibiotic that I've used before, and I get side effects. And one of the side effects that happens with a lot is that you end up with yeast infections. Yay! Anybody who has ever had UTIs, or then you end up with yeast infections, it's a vicious circle. It's like, and one of the things I've learned is that yeast can cause UTIs as well. So it's like, you get this, you take care of this thing, and every time I get them, it could be the same cause, or it could be something different. But that last one where I had to go on to this strong antibiotic, it was like horrible. You see, when you have Lyme disease, a lot of stuff affects your body. People will not understand. Part of the reason that I don't like going places is because I understand. I'm a really nice person. I don't like being mistreated. And if you're an arrogant person who doesn't care, now don't get me wrong, I'm a pretty sarcastic person. I can be very snarky, but I have a great sense of humor. But I try to be sensitive because I can see when somebody is having a hard time. Sometimes that's not the appropriate time. But not everybody has that capability. Maybe it's because I've seen illnesses in my life. Maybe it's the things I have experienced. I'd like to think that it has a lot to do with the compassion I have for people, whether you are ill, whether you are going through hard times with stress, or whether or not you're going through some hard health issues. I can't fix everybody. Doctors can't fix me either. But as a team, and back to doctor and patient, we need to communicate. We need to be able to listen and not discard what the patient is saying. But as patients, we need to listen as well and communicate effectively. I haven't always been the greatest patient. And when I found out about Lyme, I'm like, oh my word, I'm a horrible person, even though that's not my intent. Because when you respond in a negative way, and I don't think I've done it in a long time, but like with my husband, sometimes he can say something and I snap. But that's normal. Sometimes if you're mistreated by anybody, you're going to snap. So I think we need to stop and think about it. And I think the thing that bothers me about this new viral load, it's not bacteria, but it's a virus. And people are having long-term C, we'll call it. And I'm afraid that they're going to be ignored too. And I've said that from the onset. And then as I hear people dealing with it, doctors don't know how to treat this. We can't cover it up with a Band-Aid. We need to understand more fluid. And if it can't be fixed, sort of like with my Lyme disease, we just move on. So I've upped the ante with my herbs again, because sometimes I just get so tired of taking that stuff. And you know what? Sometimes our bodies need a break, and that's why I kind of take a break from it. So fortunately, I know what's happening, so I can do the best I can. And if I'm having an anxiety attack, I step back. If I'm having trouble dealing with something, I step back. If I have to have a doctor's appointment, I will let them know I'm not doing well, just so that you can be aware, I might have this or I might have that, just so you're aware. And but now with healthcare, it's hard to have that communication now, and which makes people dealing with chronic diseases, it's making it even more difficult for compassion to be received. But you know what? I can smile because I understand it. If you're with Lyme disease and you're angry at the healthcare system, there's a lot of things they can't do. There's some facilities that do not want the doctors treating Lyme disease. They don't want it. You can check out a lot of facilities. They don't have a Lyme specialist on staff. If they did, they would make billions of dollars. But they don't want to admit that this is a true disease. The longer we put people off from treatment, the worse the situation's going to get. So folks, that's part 1 of this series that I'm going to do. I have to put a disclaimer out there. I am not a physician. I cannot diagnose anybody. I know what's going on with my body because I've lived with my body. I've been diagnosed. I've done the test that proves that I am CDC Lyme, whatever. I'm going to share more about different aspects of Lyme during this series. I will try to keep them shorter. I think part of the disease causes me to be trying to be clear. I get long-winded. Or maybe that's just me. I like to talk. So please have hope. As the Lyme disease affects me, it's hard to have hope. But I've been through it before. I've lived with it for a long time now. And I know God could heal this and a few other things, he could. And as I've said on the onset, I don't know what my purpose is in life, but maybe this is my purpose, is to share awareness. And if it helps you, I hope that you like this video. I hope you share it with others and share some comments, because maybe you have something and you've been truly diagnosed that you can say, this is my experience, and then a future video I can expand upon that if it's something I've experienced or something I've researched. So I'm going to say goodbye. I hope that you have a fabulous day, and may God bless you. Enjoy.